And tonight, another looming dialysis crisis. We tell you about the ordeal of renal patients in Ghana as they demand clarity from John Dramani Mahama over whether or not dialysis treatment will remain free on the National Health Insurance Scheme.
We beg them. We are on our knees. That is why I'm saying whatever they can do to sustain this thing for us, they should. Because people's lives are in danger. We're working through someone to try to get us so that we can meet the new administration and then maybe we can sit down with them.
And in fact, there's more unfolding as Joy News hears the chilling account of an NHIS renal patient who was forced to pay for dialysis treatment on January 7th.
Very much, because it has affected me, because those who have been helping me, immediately they heard the announcement that we will be free. All help has dropped. Meanwhile, there are drugs that we've been buying.
And it's a sad reality, but tonight we need to tell you that patients suffering serious defects to their kidneys say they are on their knees begging John Dramani Mahama to give clear orders for dialysis treatment to remain free of charge on the National Health Insurance Scheme. In November 2024, the National Health Insurance Authority announced that after a 6-month pilot phase, kidney patients registered under the scheme can now access up to 8 months or 8 free dialysis sessions, I should say, per month at participating facilities. However, Joy News is now confirming that at least one patient on the NHIS scheme was forced to pay for dialysis treatment, a situation which is raising alarm as to what the future holds for renal patients on the scheme. I will get to the Renal Association of Ghana shortly, but first though, I want you to hear from the victim at the center of this, Richard Danlera, who's speaking to us exclusively tonight and narrating his ordeal on January 7th. Listen.
No, it's today that I was asked that question, that whether I'm aware I have to pay. I say yes. They already told me on Tuesday. That was on the 7th January. We at Bolga, Upper East Regional Hospital. So when I went, they told me that the free dialysis session was for only December. So we'll be paid from January. So that on the 7th I paid. But today they said we will not pay because my scheduled days are Tuesdays and Fridays. So on the 7th was Tuesday and today Friday. That was the information given to me.
So are you, as a patient, are you worried that you don't know what the future holds, whether or not in the future?
Oh, very much, because it has affected me, because those who have been helping me, immediately they heard the announcement that we will be free. All help has dropped. Meanwhile, there are drugs that we've been buying. Every session I have to buy some drugs. Every section I have to buy some drugs. So it has affected me a lot.
And that's the sad reality for Richard Danlera, who's speaking to Joy News now exclusively and also confirming that indeed he has made payments. We've done further checks, also corroborated by some of our sources within the hospital, that indeed payments were made at 11:56 a.m. on the 7th of January 2025. In fact, we'll be getting you more details as we cross to the Upper East region shortly, because this development is beginning to prompt a lot of concerns as to what the future holds for renal patients. Patients would have to pay for dialysis treatment at least twice, as is the case for Richard Danlera. But we'll get there shortly. Let's go back into history now to give you a sense of how we ended up, first of all, on this issue of the free dialysis announcement by the erstwhile Nana Addo Dankwa Akufo-Addo administration. My colleague James Aveji now joins us with details. And James, for the avoidance of doubt, let's go back. Let's look at what informed the NHI to, first of all, make this plan to capture dialysis treatment, which initially was not captured under the NHI scheme, now making it available for persons who are renal patients at participating facilities. Give us a sense of what happened.
Well, Blessed, you know that it is, some of these issues and a lot of reports that Joy News have been doing on some of these patients that we initiated the national dialogue on renal dialysis issues. And it was on one of those national discussions in the middle of last year, in fact, early hours of last year, that Dr. Kwame Sapon-Essiedu first raised the possibility of government actually taking up the cost of dialysis treatment if it really want to do this. And fortunately on that program, Dr. Anthony Nsiasari, who was the government advisor on health at the time, promised to take this to cabinet and return with some positive news. And so in June last year, government first announced that it was going to roll out a 6-month dialysis treatment.
Okay, so that was the first timeline, June 2024.
And so they were going to do that from June to November 2024 as the first 6-month pilot program, which took place in Kolebu Teaching Hospital as well as Komfo Anokye Teaching Hospital.
So if we're going by that projection, 6 months away from June 2024 would then bring us to December 2024.
Exactly. Then on December 1, government made that significant announcement that it is now going to absorb the dialysis treatment of over 1,200 patients across the country, which they have designated some 20 hospitals.
20 of them.
Exactly.
Including the Upper East Regional Hospital,
exactly,
I believe,
where this patient
is speaking from, Richard Danlera.
Yes. Exactly. Cutting across some 9 regions across the country. Now, the total cost of that every month, government is expected to pay some 2.3 million Ghana cedis to all of these hospitals every month to take care of this. The cost of one patient is around 490 Ghana cedis, and they were supposed to undergo 8 sessions every month. And so government is expected to pump monies into this.
How much a month you say?
Month. 2.3 million Ghana cedis.
So that was the initial amount per month. But here's the point, because in December last year, the National Health Insurance Authority also claimed that it had indeed stayed true to the course and had released some amount of money for participating facilities. How much was released by government in December 2024?
As of December 2024, government released 200 million Ghana cedis to the National Health Insurance Scheme as part of claim payment. What was unclear at the time was whether this was directly going to cater for the dialysis treatment, or we know that the NHIS at the time had some backlog to clear for service providers. But 200 million Ghana cedis was released out of a total government commitment of 1 billion Ghana cedis to the dialysis treatment. And so this was the amount
and
released.
That leaves us with a huge gap about funding for the first quarter of 2025.
100 million Ghana cedis funding gap out of their own commitment of 1 billion Ghana cedis to this cause.
I see. And that's raising a number of questions, because if you're piling up the debt and also making the cost projections of should happen this year. In fact, at least for January 2025, government should be preparing some 2.5 million Ghana cedis
for just dialysis treatment alone.
Treatment is the reason for which in the last few hours we've seen the renal patients themselves left puzzled over whether or not the president has given any clear directives on, and I'm talking about John Dramani Mahama, on whether or not these payments should be released. Mind you, during the transition period, orders were given for significant payments to be put on hold. But now, the Renal Patients Association are asking for a meeting between themselves and the John Mahama administration to inform the way forward on what will be done to dialysis on the NHIS scheme.
Very much worried. When I heard this, I heard it through the media airwaves that somebody has gone and he has been rejected. So I begin to inquire, which hospital was that? My brother, now patient, the mortality rate is a bit stable. Since we started, it's a bit stable now. If we need to go back, we are in big trouble. We beg them. We are on our knees. We beg them. That is why I'm saying, personally, I'm putting everything effort to, so that we can meet the government, and then we'll put our requests in front of them. We foresaw some of these things, maybe not that we foresaw, we were just contemplating. So we wanted to meet them earlier on and then see the way forward. So we are just waiting for a possible date. We're working through someone to try to get us so that we can meet the new administration, and then maybe we can sit down with them. For we are ready to, anytime an invitation is given to us, or maybe our invitation is granted, we are ready to go. It's just the time that we are just waiting for. Whatever they can do to sustain this thing for us, they should, because people's lives are in danger. I wish Joy can pick their cameras and come to Kolebu, come and see patients, the way they are suffering, their tummy. Already, Kolebu, we have a lot of challenges already. So if this one also to come and add up to it, it's going to be a big deal for us.
And don't forget, as always, the top story is brought to you by Telecel, connecting energies and Holy Insecticide Spray and Coil. Enjoy a holy sleep. And there you had the voice of the president of the Renal Patients Association, Bafo Kujo Ahenkra, explaining to us how dire the situation is and why the John Mahama administration would have to come clear on the directives regarding the NHIS payments of claims for dialysis treatment on the scheme, which is in fact not backed by law as we speak. The reason for which the concerns are emerging. Fortunately, Bafo Kujo Ahenkra is joining us now. But first, though, I want to take you to the Upper East region, where the regional hospital had that incident occurred with Danlira Richard making a payment of, I believe, 455 cedis for one of the sessions on the 7th of January 2025 at 11:56 a.m. A copy of the receipt is pointing out to us. But let's get more from, of course, Albert Sorry, who's joining us now from the region. Albert, give us a sense, first of all, what the hospital says about this. They've confirmed the payments, correct?
Yes, blessed. So what the hospital has been saying, I spoke specifically to physician specialist Dr. Emmanuel Akatibo, who was at the forefront of trying to get a renal unit for the hospital. And his explanation is that after the government listed the hospitals that were to benefit from, dialysis treatment, which will be catered for by the National Health Insurance Scheme, they waited after they heard that the Bolgatanga Hospital was also listed. They waited to get some communication from the NHIA as to how the hospital should go about this in terms of even how they can make the claims and get payments after they have done the treatments. But that did not come forth. After some time, they decided the hospital management level to go ahead and provide the free dialysis treatments while they wait for communication from the NHIA. That also didn't come. Nonetheless, they continued up to December. And towards the beginning of the year, they realized that if they were going to continue, that could affect the renal unit, because they were running out of consumables. And this was when
rather unfortunate we've lost Albert Sorry there, who's just confirming to us that indeed the hospital is now accepting the fact that that patient that we're talking about, the center of this, Richard Danlira, indeed made payments to the center, and circumstances accounting for that, basically on the uncertainty over whether or not the hospital could continue with providing funds as they await clearance from the National Health Insurance Authority. Joining us now is Dr. Emmanuel Akutibo, who's a physician specialist at the Upper East Regional Hospital. He'll be speaking to us shortly. But just briefly, sorry, we lost you there when you're just about landing on the point.
Yes. So this was when they decided to take the decision to let the patients cater for the cost. But what the hospital wanted to do was this was a temporary measure, so that when the NHIA starts making payments, then they can see how to reimburse the patients who have made the payments. But after some time, yesterday, the management of the hospital held a meeting at which they decided that they will go back to the free dialysis treatments while they wait, also because there's now been a change in government.
Yeah.
So those patients who have made the payments, when the NHI gets back to the hospital and all the issues are addressed, then they will reimburse
I
those
see.
who have already made payments.
And this is a very instructive, base you're forming for us for this conversation because of the transition. All major and significant payments have been put on hold by the transition team. Looking at the funding gap, that's about 800 million Ghana cities that we're dealing with now in terms of claims financing gap for the National Health Insurance Authority. Unfortunately, Dr. Akutibo is with us. The president also of the Renal Patients Association, Bafo Kujo Ahinkra, is also with us. Bafo, I'll come to you shortly, but let's hear from you, Dr. Akutibo. The point about what's informing the decision of the hospital now to at least proceed with a free treatment in the interim when it is clear that there is a financing gap. Who's going to pay for this?
Yes, honestly, that has been a very big challenge to us, and taking this decision to go back to what we started in December after the health insurance gave an order that we should do free dialysis for the patient hasn't actually been easy. And sometimes we look at these patients and we understand the challenges that they go through. But one of the key things that we're also so worried about is that we are just a new unit. I think we should be the baby unit for dialysis centers in the whole country. And we currently have 3 machines, mostly 2 are more active working. And we have more than almost close to 20 patients. And we're worried that if we don't take time, we will crash and it will affect even these patients who will now have to travel to Tamale. So it wasn't an easy decision in telling the patients to pay initially. But after management met and had discussions, looked for other options, they decided that, okay, let's continue the free whilst we see communication from the authorities to see the way forward and see whether we can make a case for them to pay the facility as soon as possible so that we can be able to maintain the unit. Otherwise, if we keep going this way and we don't get a clear communication as when they will be able to refund us those monies, we may end up crashing and our patients will suffer more.
So as we speak, how much is involved here? And do you have a clear commitment, either from perhaps the NHIA or the new government on the financing gap? Because that's critical to your operations there.
So as of now, we do not have a clear communication. I know probably the medical director and administrator made some communications yesterday, but I'm not privy to it, whether they were able to get to them directly to get the clear picture of it as to what is the way forward. But what I can confirm is that they got back to me yesterday and instructed us to continue the free dialysis for them. So I think the payment was made for only 2 days, I think on the 6th and 7th of January. But after that, the rest who come, we've been doing it free for them. And I think it's 15 sessions of dialysis, including 12 patients that they paid. And we even documented their receipts and asked them to keep it, so that when we resolve the issue, we refund it. But if you came to the hospital from yesterday, today onwards, we are continuing the free dialysis session that was announced by the Health Insurance Authority until maybe the management of the hospital gives us any information as to what we should do next. Yeah.
How much time do you have? Because this is about, like a lifeline, if that's how best to describe the situation. How much time do you have to keep on running the free scheme, at least until you get, a clear communication from the NHI?
To be honest with you, I really don't know, because yesterday one of the stores people told us that, the nurse in charge of our unit, he told us that our stock is running down. The consumables we use for the dialysis is running down. So I'm hoping that management may find money somewhere else, maybe take it from hospital, somewhere else from the resources in the hospital. I don't know, maybe to get us something whilst we work this thing out, because the longer it takes, the more challenges we will have. And we don't want to get to a point where the unit is shut down completely. That will be disastrous for our patients and for us.
So you're almost, and you want to confirm to us tonight that you're almost getting there, correct? That your unit may be shut down.
I am sure if the next few weeks, the next week or so, if we don't, I'm hoping that management will be able to mobilize resources somewhere else. If they will not be able to do, then we'll run into trouble.
Which
to run
means
it.
which means you would have to shut down.
Yes, yes.
That's a critical situation here. And I'm just wondering, Bafo Kujo Ahinkran is the president of the group. What you make of this stark revelation coming through? In fact, when I was interacting with you earlier today, you told me about how worried you were for patients across the country, given the fact that treatment of dialysis is, a very, very expensive exercise. How are you feeling now, knowing that indeed that's becoming the reality? What's the way up?
Thank you. But the point is, I don't even know where to start from because, like, all of a sudden, this is like a shock to me because, like you are saying, what they are saying, I really understand and I appreciate what they are doing there. But what can we say? I don't know how the whole thing is going because that was not the understanding we were made to understand initially when this thing was being set up. Because we were made to understand now it is part of their package claims for the National Health Insurance. It's part of their package claims. So I don't know how the Bolga people understood the whole thing because we were all invited to a meeting and we had a discussion on all these things on there. I remember Bolga, they sent somebody, they came there. So the only thing I can say for now is that we are pleading with the National Health Insurance and then the new government. This is between life and death. Whatever they can do as quick as possible and settle them because the rest of the hospitals are running smoothly. I spoke to Kumasi. Kumasi is working. Kipus is working. Ifi Kwanta is working. Ho is working. Kulibu is working. This morning I was at Kulibu. They were dialyzing smoothly. So if our brothers up there are having challenge, then we'll plead with those authorities, those in charge, that is to fast track things, see to them, and then let's see the way forward.
And you may never know. Perhaps these hospitals that are functioning properly are doing so, awaiting further communication, just as Dr. Katibo is explaining to us. But looking forward, and just some clarity on this matter. When you had the meeting with then the Vice President, the Presidential Advisor on Health, what were you told really? Because the announcement was that the free dialysis will take effect in December. No clear timeline as to whether or not there's going to be a perpetual exercise.
What we need to understand after the pilot for the 6 months and then December we started, because the numbers we give them, the numbers we have, the whole country was I think around 600. So they double it to the 1,200. So at least the calculation they did should not be giving us what we are expecting now. Well, I don't know because we give them it was around 600 to 800 the population that we have. And so then let's double it and let's see the way forward. So for now, that's like all these things are coming because we were even made to understand come the next 5 years, it's capable for them to National Health Insurance to take care of us. So this thing coming in today is a bit surprising to me. And like I'm telling you, I'm very much worried. I'm very, very much worried about this whole thing because I thought now we are a bit at rest for now. We are not thinking of our medications, our dieting, our injections. Those ones too are very expensive. So this one, when this thing came in, we are now focusing on the medication, the injections, your labs, normally monthly routine. All those things are money. So if these things should come back to us, we can't bear it.
Indeed, a surprise to many of us as well. Dr. Katibo, and just to get back to you on the way forward and interim measures that you might want to be taking now. Some hospitals at least have supplies of the consumables. Are you perhaps putting it as part of your plans to interact with them, try and share resources with them? I mean, how difficult is it managing the situation now in terms of the plan B? I guess that's what I'm asking.
Yeah, so I think I may not be completely privy to everything management is doing, but this is something that I know they thought through yesterday when they held a meeting and decided that we should continue the free dialysis for them. But what I know is that our consumables are low on stock. So what it means that management have to find money somewhere else to restock us until we get a clear communication from health insurance as to when they are going to pay and how the mode of payment that is going to happen. So otherwise, I don't know if management doesn't find money to get us the consumables, we may run into trouble because we were just one of the new units that opened few months before this free dialysis issue came up. So from the initial communique, we weren't even part of the meeting that was held to streamline this whole thing, because they gave us a letter a day before the meeting. And so none of us could represent the Upper East region to know what was going on. So those were some of the challenges we had initially. We didn't get any clear way forward as to how we're going to go about this. But I'm hoping that management will get in touch with them so that we can solve this problem before our patients will have challenges.
And just a bit of an education on this subject of renal treatment. How complex an exercise is it?
Yeah, so I think the president just spoke to you. It's not just about the dialysis alone, but their medications can even be more expensive. It's even more expensive more than the dialysis sessions alone. And the labs they are even supposed to do is also very expensive. So when this dialysis issue came up, at least it really gave some of them room to be able to use part of that money to purchase their drugs and do their labs so that we can manage them appropriately. So it's not just the dialysis component, but holistically, the medications and other things they need to do is expensive. Their nutrition, all inclusive, is expensive. And it's a real big challenge. If you have never cared for a patient who has end-stage renal disease and on dialysis, you will not understand when they talk to you.
And we can just as much sympathize with them and wait for some more clarity on this. Dr. Emmanuel Akutibu, physician specialist at the Upper East Regional Hospital, joining us now. Grateful for your time. Bafo, could you have any final appeal to the John Mahama administration, because you say you want a meeting on this matter?
We really want to meet them and maybe explain things to them better. Maybe they want to put our problem to them for them to know, because like I was saying, my brother, like the doctor just said, if you have not catered for somebody like that, you don't know what goes into it. And for now, we beg them they should try and hold us in their palm small, and then let's find a lasting solution to this, because if this thing is to stop today, tomorrow the news that you guys will be hearing and the mortality rate, you will not like it.
And of course, we wait to see what the future holds for many of you who are really troubled at this latest development. But that's Bafo Kojoahinkran, who's the president of the Renal Patients Association. Also, earlier you heard from Albert Soriaba, Upper East regional correspondent, and also grateful to you, Dr. Emmanuel Akutibu, who's a physician specialist at the Upper East Regional Hospital. My name is Blair Sugan. Top story. It has been brought to you by Telecel, connecting energies, holy insecticide spray and coil. Enjoy a holy sleep.